what can we do? What should we do? What must we do? First of all, we want the premise that health care should be affordable and available to all Americans, right? We all want it available and affordable to all Americans. How do we do that? How do we do that? Let me just give some ideas. Let's focus on what we can afford. I talked to you about the fiscal problems we're in. Insurance reforms to improve access. Let's make sure that Americans are not denied access to insurance policies, and those who have pre-existing conditions, those who are, quote, uninsurables, let's put together risk pools and get them insurance so that they'll have it available. Let's reform medical malpractice. My friends, any one of our physicians will tell you that they practice defensive medicine, and understandably so, because of their fear of being sued. In no bill that's going through Congress right now is medical malpractice reform part of the bill. Why? Because of the trial lawyers. Duh. So we could save $100 billion a year in health care costs just by allowing physicians not to have to practice defensive medicine in the prescription of tests and procedures that are absolutely unnecessary. There are some specialties that are paying as much as $200,000 a year for their insurance, for medical malpractice insurance. Who ends up paying for that? We all know who does. We all know who ends up paying for that. Let's have tax reforms and incentives to purchase insurance. During the campaign, I was much maligned because I said that we should give every family in America a $5,000 refundable tax credit so they can go any place in America and purchase the insurance of their choice that best suits the needs of themselves and their families. And we should be, right now you can't go across state lines. If you live in New York and you think that there's an insurance policy available in Arizona that's better, you're not allowed to do that? Why in the world is that? And as you know, there's great disparities between the cost of health insurance varying from one state to another. By the way, back on malpractice a second, California has enacted some real improvements. Texas has enacted some real improvement. We need national change to medical malpractice. Let me mention... I'm not going to get into more details, but one of the great increases in costs that we have today is, of course, the readmissions to hospitals. Everybody here knows someone who went in the hospital, was discharged too early, and then had to go back to the hospital again, and the costs are dramatically increased. Now, the problem there, my friends, is the insurance companies, and the doctors who know that they won't pay for more than a few days. That needs to be changed. That needs to be changed as well, as you know. So I mentioned about the risk pools. I mentioned about long-term cost reductions. What are those? Wellness and fitness. Wellness and fitness. There's a guy who's gotten pretty famous lately, and he's the CEO of Safeway. And you know what they've done at Safeway? They have programs and policies that incentivize their employees to practice wellness and fitness, not to smoke, to work out, to do exercise, to get regular physical checkups, and they give them cash rebates even. And they give them the policies that fit their particular needs. And guess what? Safeway's healthcare costs have gone down. Why can't we adopt that on the national scale? Why can't we reward people for practicing wellness and fitness in our country? Finally, there are many things that we can do sitting down together. But I want to emphasize again to you, if we go to this government option, okay, that they call the public option, then one of two things will happen. It'll be just another insurance policy that's available out there, along with 1,500 other insurance companies in America, or you will see the government advantage come into play, and you will see more and more movement of the government into health insurance, and you will see the disappearance of private health insurance in America over time. So I'm very concerned. Now, what you want us to do, and what I want us to do, is remove this, quote, public option off the table. Let's sit down together. Let's enact some of these reforms that's just there. I am sure that my friends, my Democrat friends across the aisle, would agree with most of them. Maybe not. The trial lawyers are too powerful on maybe those. And let's have a beginning. Right? And one other real quick. We need to have outcome-based treatment, payment for treatment as well. If someone has a chronic disease and that person is going to need treatment for a period of time, let's say, okay, we'll give you X amount of dollars, and if that patient is better, in better health at the end of that year or period of time, then we'll give you a reward, okay? Outcome-based treatment, rather than paying for every single procedure. Many of you have seen your bills and the cost for each one of those individual procedures and treatments. So I'll stop now and say that, look, America's a great country, and one of our obligations is clearly to provide every American with an equal opportunity to better their lives and fulfill the obligation that our parents and our grandparents have, and that is to give to our children a better country than the one that we inherited. Now, we've got to make health care affordable and available to all Americans. And we don't want to lay a debt on them for treatment of people who are seriously ill so that their premiums are unaffordable. But I'm confident that sitting down together, Americans, with the same goal in mind, affordable and available health care, and a quality that is still the best in the world that needs to be maintained, that we could all work together. I'm grateful for the town hall meetings. I'm grateful that you're here. I'm grateful for your involvement. And I'll tell you right now, if it had not been for these town hall meetings all over the country, I believe that health care reform and a government plan would have been railroaded through the Congress by now. Thank you, and God bless you. Thank you for being here.